I'm Dr. Kenneth Lewis, and you may have been referred for an interventional pain procedure. And I want you to be aware that every procedure we have has the capacity to be aided by some light sedation. Don't be worried about the sedation. It won't have you off to sleep. You'll be able to communicate with me at all times. But the sedation will allow you to be a little bit more relaxed, and more importantly, will blunt some of your memory if there's any discomfort with the procedure. And that's specifically important with follow-up visits, because I want you to be able to focus on the long-term treatment effects of your injections and not the actual process itself. And as I mentioned to most of my patients, there's not a single procedure that I perform that you can't do without sedation. And there's not a single procedure that I perform that's not better if you have the sedation. If you have sedation, you can't be your own driver. So I do encourage you, regardless of sedation, to have someone else drive you so that after your injection, you can just relax and not be worried about traffic on your way back home. So try to have a driver and consider very strongly the option of having some very light sedation. It is under a very controlled situation. I'm a board certified anesthesiologist. All the nurses here are very capable at providing that light sedation, and most of them are also emergency room nurses. So come prepared for sedation and try not to be your own driver if you can.